The procedure will be performed in a room specifically designed for angiography of the nervous system, the neuroangiography suite. This room is equipped with fluoroscopy machines that use X-rays to create images of blood vessels as the contrast is given through the catheter into the spinal vessels. The pictures are recorded and displayed on screens that the radiologist watch as they are performing the procedure. The doctor will look at the picture more closely after the procedure. Since you will be admitted to hospital one day before the procedure, ward nurse will monitor your vital signs such as blood pressure and oxygen saturation in the early morning to ensure that you are ready for this procedure. Doctor will place a needle on your arm and you will then be sent to the angiography unit, wearing a hospital gown. You will be then sent to the waiting area at angiography unit. An angiography team member which includes specialists such as radiologist and neurologist, nurses and radiographer will take part in the procedure. On top of that, an anesthetist will also be joining the procedure to monitor your condition since this procedure will be carried out under general anesthesia. Once in the angiography suite, radiographer and nurses will help to transfer you from the stretcher to the couch. Armrests will be put in place for your comfort. The team will make every effort to make you as comfortable as possible. As it is necessary to keep the room at a cool condition due to the equipment present, we may provide you blankets and warmer. It is necessary for you to lie flat throughout the procedure. Electrocardiogram and blood pressure monitor will be used to monitor your vital signs. Then, the anesthesia will be given by anesthetist. This minimizes movement of the patient, which degrades imaging, and allows for control of breathing and peristalsis as the procedure usually takes longer time to complete. The area of your access site, usually the right groin, will be cleaned and shaved. The area where the catheter will be inserted will be numbed. Seldinger technique will be used for catheterization. The radiologist will first place a needle into the lumen of your femoral artery through a small skin incision. In this case, accessing the leg artery gives the radiologist a direct pathway to the vessels of the spine and spinal cord without crossing or coming close to the heart. This is then followed by a guide wire insertion that advances to the thoracic aorta since the area of interest will be at T5 to T10 region in this case. During this procedure, radiographer will obtain fluoroscopic image that guide radiologist to advance the guide wire. Once the guide wire is at the region of interest, the needle will be removed. Once the guide wire is at the region of interest, the needle will be removed, and the radiologist will then thread the sheath over the guide wire. Then, the guide wire will be removed. And a long flexible plastic tube, specifically Cobra catheter, will be threaded over the sheath through the femoral artery to the desired location, specifically at thoracic aorta at around T5 to T10 where the fistula is more likely to occur in this case.